Today we'll be talking about Asian rhinoplasty, and this is the first video of the series of Asian rhinoplasty that we'll be discussing. Initially, Asian rhinoplasty, before we start about Asian rhinoplasty, I would like to talk about the aesthetics of Asian noses and what the goal is. It is important to look at the overall face and to perform Asian rhinoplasty that will be proportional and that would fit the individual patient. Asians tend to have wider faces, and therefore the nose needs to be proportional to the person's face. Since Asian rhinoplasty is an augmentation rhinoplasty in that the nose has to project more to make the face look narrower and also to give it more features and better light, shadows, and reflections. Asian rhinoplasty is unique in compared to typical rhinoplasty or Caucasian rhinoplasty in that Asian rhinoplasty deals with expansion, and it deals with pushing cartilage against limited tissue or surrounding tissue, whereas typical rhinoplasty, which deals with, for instance, Caucasians, deals with reduction. So there's no tension that the surgeon has to deal with, and the patient will face throughout their lives. Therefore, Asian rhinoplasty is a very unique aspect of rhinoplasty in that not only do we have to deal with tissue relocation, the relocated tissue, the underlying tissue, which is the cartilage, has to, in essence, withstand the surrounding force that is compressing it and that would want to push it back to its original position. Therefore, Asian rhinoplasty requires deep understanding of tissue tension, force, and elasticity concepts, and tissue mobilization and adequate stabilization concepts in order to successfully perform Asian rhinoplasty. Asian rhinoplasty, therefore, deals with cartilage relocation and tissue tension. What do I mean by that is that in order to reposition the nose, the cartilage, which is the underlying framework of the nose, needs to be repositioned. This is a fundamentally different rhinoplasty surgical techniques that is applicable for Asians and not in Caucasians. So by releasing cartilages and relocating them, this will create tension in the surrounding skin and the soft tissue. Therefore, one would have to understand tension and accommodate for the tension that the nose will be facing after the surgery. This is very important in order for the nose to have a natural result and a long-lasting result as well. There are different types of Asian noses, and in general they fall under one, short or low-set noses. These are the most common types of Asian noses in that the nose is low-set, they have low radix and bridge, and the tip is also inadequately projected. The second is a hump nose where the bridge is projected but the tip is not. And the third is where the tip is bulbous in that it doesn't have nice shape and it is more round and in essence a further projection and tip definition will really enhance the person's overall facial and nasal features. So we'll talk about these main categories of Asian rhinoplasties in our next videos. So we'll talk about the advantages and disadvantages of silicone implants and how the silicone implants or other implants can be safely and effectively be used in Asian rhinoplasty. And also, we'll also talk about alternative methods of performing Asian rhinoplasty without the use of implants as well.